The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Guys, let's go to physiology. Number 61, which of the following factors contributes to the negative membrane potential of resting cells? Is it because of potassium, sodium, calcium, or chloride? So the correct answer is A, the concentration gradient of potassium ions. Bakit? Let's discuss the resting membrane potential. Think of ions as people with different personalities when it comes to how they move across the cell membrane. So may kanya-kanya silang inherent characteristics in how they move. Okay, RMP is established by the interplay of how each ion moves across the membrane. And since the membrane is most permeable to potassium, the concentration gradient of potassium will determine the resting membrane potential. How do you remember this? Membrane potential, potassium. Okay. Alright, 62. Which of the following is the primary mechanism for the clearance of glucose from the blood? Is it because of diffusion, sodium-glucose transporters, or endothelial cell pinocytosis? The correct answer is letter B, active transport by sodium-glucose transporters. Okay, so let's discuss glucose transport in the body. What is the main mechanism by which glucose enters the body? Of course, that's by eating. And second, when you eat, what is the first organ where you can find high amounts of glucose? Of course, that's in the small intestines. Why? Because when you eat, saan ba pupunta yung food? Diba una sa GI tract sa small intestines? At first, doon pinakamaraming may glucose, right? And what are the glucose transporters in the small intestines? It's the SGLT transporters. And what is the mechanism of SGLT? It's secondary active transport. So that answers the question. Okay, let's go to the glucose transporters and their locations and functions. So GLUT1 is found in RBC. It functions for glucose uptake. GLUT2 is found in the pancreas. Also functions for uptake and release of glucose. GLUT3 is in the brain and placenta, also for glucose uptake. GLUT4, very unique ito. It's in muscle and adipose tissue and it is insulin stimulated, insulin dependent. While GLUT5 is in the small intestines and spermatocytes, and this is also unique because it's for the absorption of fructose. While SGLT1 and 2 are in the kidneys and small intestine, and it's sodium dependent active uptake of glucose against a concentration gradient. Okay, let's go to 63. A 55-year-old man presents with a history of slurred speech and difficulty walking. On examination, he has weakness on the right side of his body and decreased sensation on the left side. Further investigations reveal that he has a large ischemic stroke involving the left middle cerebral artery. Which of the following structures is most likely to be affected by the stroke? Okay, so you have motor symptoms. So the correct answer is the primary motor cortex. So let's look at the localization. When the primary motor complex is affected, the deficits are usually motor. If it's the primary somatosensory complex, it's sensory. Thalamus also sensory, and cerebellum coordination. Okay, how about 64? A 50-year-old woman presents with a history of weakness and numbness in her legs that is worse at night. On examination, she has decreased sensation and muscle weakness in both legs. Which of the following is the most likely diagnosis? And the correct answer is GBS, Guillain-Barré syndrome. So honestly, this is a very difficult question because we don't often see these disease entities. Medyo rare din, no? Parang hindi pa nga ako nakakita ng ALS. Okay, but let's try to differentiate them, no? Multiple sclerosis, ang keywords natin dyan, episodic, neurologic deficits with patchy lesions. Meron din siyang visual loss. So, pag may nakita kayong case na may visual loss, probably meron tong multiple sclerosis, no? How about ALS? So, ALS, ang unique dito, may lower motor neuron and upper motor neuron signs. So, lower motor neuron, kaya may weakness, and upper motor neuron, kaya may fasciculations. How about GBS? More of lower motor neurons siya. So, kaya nagpe-present siya with paralysis and areflexia. And, interestingly enough, they found that pain is worse at night. How about spinal cord injury? Usually may history of trauma yan, and the deficits depend on the level of the lesion. Alright, let's go to 65. What is the difference between tonic and phasic receptors? Okay, medyo mahaba yung choices natin. Let's dissect it. Okay, mali yung B. Bakit? Tonic receptors generate graded responses to a stimulus, while phasic receptors generate all or none responses. Mali! All sensory receptors generate graded responses, and these are not action potentials. So, mali yung B. Okay, correct yung A. But let's look at C and D. Tonic receptors are located in the skin, while phasic receptors are located in the muscles. Mali din yan. Both tonic and phasic receptors can be found across the body. Letter D. Tonic receptors are involved in the detection of low-frequency stimuli. Phasic receptors naman high-frequency stimuli. Mali yan. Difference is based on how they fire and not on what stimuli they detect. Okay. Whereas, tama yung A, tonic receptors generate sustained responses to a stimulus, while phasic receptors generate brief responses. Let's look at the differences between tonic and phasic receptors. Tonic receptors are slowly adapting, while phasic receptors are rapidly adapting. Tonic receptors fire throughout the entire duration of the stimulus, while phasic receptors fire at the start and end of the stimulus. So, tonic, letter T, tagal. Phasic, fast. Okay, let's look at this photo. So, makikita mo yung tonic. Throughout the entire duration of the stimulus, nagfa-fire siya. While in phasic receptors, dun lang sa start tsaka end. So, tonic, tagal, phasic, fast. Okay. 66. Which of the following types of sensory receptor is involved in the detection of temperature? Temperature. The answer is letter D, free nerve endings. So let's look at the different types of receptors. The Meissner's corpuscle is for touch and pressure, fast. Merkel cells, touch and pressure din, pero slow. Pacinian corpuscle, vibration. Ruffini corpuscle, steady pressure. And free nerve endings for touch, temperature, and pressure. Okay, how can you remember this? Temperature. Free nerve endings detect temperature. Okay, let's look at number 67. Which of the following is responsible for the plateau phase of the cardiac action potential? Plateau. The correct answer is A, L-type calcium channels. Okay, let's look at the cardiac action potential, no? Phase 0 is the rapid depolarization. Phase 1 is rapid repolarization. Phase 2, plateau. Phase 3, final repolarization, and Phase 4 is resting. So, let's look at this table summarizing the events, the ions, and the channels. So, in Phase 0, may upstroke, di ba? Ganon. So, what happens? Sodium enters. How? Anong channel? Fast voltage-gated sodium channel. Phase 1, yung after umakyat, slight bababa, slight downstroke. Bakit? Potassium leaves via the voltage-gated K channels. And then after tumaas, pababa, magpa-plateau, flat. Flat siya. Bakit? Because calcium enters via the L-type calcium channels. And then phase 3, pababa na because K is leaving. through voltage-gated potassium channels. Phase 4, nandun na siya sa back to normal, resting. Meron ng equilibrium established by the NAK80 phase. So how do you remember all this? The best thing is to remember phase 2, Plat2, calcium 2+. Okay, classic mnemonic. Let's go to 68. What is the function of the Frank-Starling mechanism in the regulation of cardiac output? Frank-Starling cardiac output. The correct answer is letter D, to match cardiac output to venous return. Okay, let's look at the Frank-Starling mechanism, no? So in the Frank-Starling mechanism, it states that if there is high venous return, it means there's high right atrial pressure. And that means nasi-stretch yung cardiac sarcomeres. Nasi-stretch, parang rubber band, no? Pag stretch mo yung rubber band, boom! Boom! Mataas yung force of contraction. Therefore, kung mataas yung force of contraction, mataas yung stroke volume. Kung mataas yung stroke volume, mataas ang cardiac output. So in essence, venous return equals cardiac output. Stretch, boom. Stretch, boom. Okay. Let's look at number 69. What is the respiratory quotient for a healthy adult burning 100 grams of pure glucose? Again, may math na naman tayo. Be prepared for that. The correct answer is 1. Bakit? Let's look at the respiratory quotient. It's calculated by the volume of CO2 produced divided by the volume of O2 consumed. The respiratory quotient is calculated by dividing the volume of CO2 produced by the volume of O2 consumed. So, babalik tayo sa basic chemistry. In the oxidation of glucose, we know that the balanced chemical equation is C6H12O6 plus 6 oxygen equals 6 carbon dioxide and 6 water. So, based on that equation, meron kang 6 moles of carbon dioxide produced and you used 6 moles of oxygen. So, 6 divided by 6, 1. Let's look at this handy table, handy-dandy table. If the substrate is glucose, typically the respiratory quotient is 1. Whereas in fatty acids, it's 0.7 and in protein, it's 0.9. Okay? Let's go to number 70. A 45-year-old man with a history of chronic obstructive pulmonary disease is found to have a functional residual capacity of 6 liters, a residual volume of 3 liters, and a total lung capacity of 9 liters. What is his inspiratory capacity? So again, guys, math. Okay, the correct answer is C, 3 liters. Okay, let's look at this very beautiful graphic of lung capacities. Okay, sabi sa case, total lung capacity is 9 liters. They also said the functional residual capacity is 6 liters. So 9 minus 6, 3 liters ang inspiratory capacity. Okay, so when you're confused, just remember this drawing. And also Doc Broly's famous mnemonic, ITER 4321. Okay? Let's go to 71. Which of the following factors does not affect the filtration coefficient of the glomerular filtration barrier? Does not affect, ha? Okay, is it surface area, permeability, thickness, or diameter? Does not affect. The correct answer is D, diameter. Ibig sabihin, surface area, permeability, and thickness, they all affect the glomerular filtration barrier. Whereas, letter D, diameter, wala siyang connect. Let's look at Starling forces, no? So, this is this age-old photograph of Starling forces which determine whether filtration happens or absorption happens. So, I summarized it in this table. Forces that favor filtration are capillary hydrostatic pressure and interstitial oncotic pressure. Whereas forces that favor absorption are capillary oncotic pressure and interstitial hydrostatic pressure. Aside from that, let's discuss more about the filtration coefficient. So what's the filtration coefficient? It measures how easily a substance can be filtered across the barrier. And it is determined by surface area, permeability, and thickness of the basement membrane. Remember, the diameter of the afferent arterioles affects the glomerular capillary hydrostatic pressure but not the filtration coefficient. So, medyo tricky yun. Okay, let's go to number 72. A patient with chronic kidney disease is given a medication that blocks the RAAS. Which of the following is the most likely effect of this medication on his potassium levels? The correct answer is B, increased serum potassium. Let's look at the RAAS system. First step, juxtaglomerular cells make renin. And then number 2, renin converts angiotensinogen to angiotensin 1 or AT1. Number 3, ACE from the lungs converts AT1 to AT2. And number 4, AT2 stimulates aldosterone production from the adrenals. Now, ano bang effect ng aldosterone? So, aldosterone increases sodium reabsorption in the kidneys. And it increases potassium secretion in the kidneys. And H secretion also. So, kung may aldosterone, sodium is inside the blood. More sodium from the kidneys going to the blood. Tapos, ang kapalit ng sodium, potassium. So, sodium in, potassium out. H out. So, kung walang aldosterone, baligtarin mo lang yon. Sodium out, potassium in, and hydrogen in. So, be careful when you're giving RAAS blockers. Di ba baba yung aldosterone? And it can cause hyperkalemia in susceptible patients, especially yung mga may CKD. Okay. 73. A patient with a history of lactose intolerance consumes a large amount of milk. Which of the following is the most likely effect of this consumption on his gastrointestinal function? So, lactose intolerance, no? Magkakaroon ka ng LBM. Pag may LBM ka, there is increased bowel movement and increased transit time through the colon. By increased transit time, ibig sabihin kakakain mo palang lalabas na sa puwet mo. Okay, so ganun yung nangyayari sa LBM, di ba? Kakakain mo palang, mapupupo ka na. Increased transit time or mabilis. So let's talk about lactose intolerance. So what happens? The body cannot digest lactose. And undigested lactose accumulates in the lumen of the small intestine, and this attracts water, causing osmotic diarrhea and increased transit time through the colon. Okay, number 74, a patient with severe diarrhea is given a medication that inhibits the absorption of chloride in the colon. Which of the following mechanisms is most likely to be involved in the action of this medication? Okay, so the correct answer is B, inhibition of the CFTR chloride channel. Let's look at ion transport in the colon. Chloride is the primary ion secreted into the intestinal lumen. Where chloride goes, sodium and water follow. So, clingy yung mga yan Sodium, chloride, water, magkakasama yan. So, if you inhibit chloride secretion, this can help elevate diarrhea. Let's look at the other choices, no? The NAK ATPase and basolateral potassium channels are involved in the maintenance of the electrochemical gradient, whereas the sodium and hydrogen exchanger is involved in the regulation of pH. Okay? Okay, number 75, a patient with hyperthyroidism is given a medication that inhibits the activity of the sodium iodide symporter in the thyroid gland. Which of the following is the most likely effect of this medication on his thyroid function? So, meron kang hyperthyroid patient. How would you treat this? You would give anti-thyroid medication. So, mali na yung A and C. Kasi A and C increase synthesis of T4, T3, and C increase uptake of iodide. So, pipili ka na lang B or D, no? Decreased secretion of thyroid hormone or decreased conversion of T4 to T3. And between them, the correct answer is letter B, decreased secretion of thyroid hormone. Kasi in the question, the medication inhibits the NIS. So this is involved in secretion of thyroid hormone, not in the conversion of T4 to T3. So let's look at thyroid hormone synthesis. Very high yield ito. Step 1, synthesis of thyroglobulin. Step 2, iodide uptake via NIS. Step 3, iodide transport to follicular lumen via pendrin. Step 4, organification. Step 5, coupling. Step 6, endocytosis. Step 7, hydrolysis of T3 and T4. And Step 8, recycling. Okay? So, very, very high yield yan kasi yan din ang pharmacologic targets for therapy. Okay? Let's go to number 76. A patient with type 1 DM is started on insulin therapy. Which of the following effects is most likely to be observed after the first dose of insulin? Okay, so remember, insulin is an anabolic hormone. So build, build, build. Okay, and the correct answer is decreased hepatic glycogenolysis. Okay, bakit? Okay, letter A, mali. Increase hepatic glucose production. Kasi this is catabolic. When the liver is making glucose, that means it's destroying glycogen to make glucose and spread it to the body, which is generally a catabolic process. Letter C, decrease peripheral glucose uptake. Insulin nga, in. Glucose in. So, increased peripheral glucose uptake. And letter D, increased gluconeogenesis. We know that gluconeogenesis is a catabolic process. So, mali din yon. So, bakit tama yung B? Decreased hepatic glycogenolysis. Insulin is anabolic. It's build, build, build. So, you want to prevent breakdown. So, decreased hepatic glycogenolysis, decreased breakdown of glycogen. Build, build, build. Let's look at this very high yield table differentiating insulin versus glucagon. Insulin is anabolic, glucagon is catabolic. Insulin encourages glucose uptake from blood going to the tissues. So there's increased peripheral glucose uptake as we discussed earlier. Whereas glucagon encourages glucose output from the tissues going to the blood. So there's increased hepatic glucose output. So insulin promotes glycogenesis and lipogenesis. Yung mga genesis, typically insulin yon. Glucagon promotes glycogenolysis, beta oxidation, and gluconeogenesis. Okay, very high yield ito, no? So make sure you know your integration of metabolism. Okay, number 77. Which of the following hormones is responsible for the initiation of spermatogenesis in the testes? And the correct answer is A, follicle-stimulating hormone. So let's look at this mnemonic: SSS, FSH, Sertoli, sperm. LLL, LH, Leydig, libido hormone or testosterone. Okay. 78. Which of the following hormones is responsible for the maintenance of the corpus luteum in the luteal phase of the menstrual cycle? So, maintenance of the corpus luteum in the luteal phase, that is C, progesterone. Okay, C, progesterone. Let's look at the hormones of the menstrual cycle. FSH is for follicle development. Estrogen, also for follicle development and also for endometrial proliferation. LH, pag LH, matik yan, ovulation. LH, ovulation. And progesterone maintains the endometrium and corpus luteum. 79. Which of the following changes occurs in the cardiovascular system during exercise? And the answer is letter D, increased stroke volume. Yeah, increased stroke volume. So let's look at the effects of exercise on the cardiovascular system. Heart rate, stroke volume, cardiac output, and arterial pressure all increase. Pati pulse pressure nag-i-increase. Remember, because pulse pressure is directly proportional to stroke volume. And total peripheral resistance decreases due to vasodilation of skeletal muscle beds. Which makes sense because when you're exercising, you want to provide as much blood, nutrients, and oxygen to your muscles. Therefore, magvavasodilate yung arterial system sa mga skeletal muscles to allow more blood flow. Okay? And number 80, which of the following occurs in the respiratory system in response to high altitude? And the answer is A, increased alveolar ventilation. So very high yield ito, no, respiratory responses to high altitude. Typically, these are the following things that increase RR, alveolar ventilation, arterial pH indicating alkalosis, hemoglobin concentration, 2,3 BPG, pulmonary vascular resistance, and pulmonary capillary density. Whereas alveolar PO2 and arterial PO2 will decrease. And that's it for physiology.
Sige, lag-med naman tayo, no? So, start tayo lag-med, okay? So, first question. Which of the following is not a prerequisite to practice medicine? That's your letter C, internship with the curriculum prescribed by the Board of Medicine. So, there are only 3 prerequisites to practice medicine. So, age, dapat at least 21 years. You've passed the PLE. So, how do you pass the PLE? You have an average of 75% with no grade in a subject lower than 50%. And a holder of valid certificate of registration. So the reciprocity rule is needed so that foreign citizens can take the PLE. So hindi automatic na pag may reciprocity rule, pwede na silang hindi mag-take ng PLE. So they still need to take the PLE to be qualified in our country. Okay? And remember, although an internship is required to be able to take the PLE or graduate from medicine, so the internship curriculum is recommended by the Board of Medical Education, not the Board of Medicine. Okay? So here are some of the differences lang din to remind you ng Board of Medicine tsaka Board of Medical Education. So basta curriculum and everything about teaching medicine, that's your Board of Medical Education. Anything about the practice of medicine itself is your Board of Medicine. Just take note, important things to note. The Board of Medicine determines the contents and the rules of regulation and regulations for the PLE. However, the administration itself, the PLE, is done by the PRC itself. Okay? And another important one is that the Board of Medicine can actually issue subpoena to be able to perform its duty. So, for example, if may investigate sila to suspend, revoke, or reissue certificates of registration, they can issue subpoenas to witnesses or the person being complained. Okay? So, those are the differences. Sige, next question tayo. So, 26-year-old male who needs emergency surgery. So, who is prioritized in giving consent? The correct answer is letter C, his brother. So, bakit? Okay, so for the prioritization of consent for patients of legal age, so di ba si patient is 26-year-old male. So, you first is the patient, then their legitimate spouse. Again, keyword there is legitimate. So, yung mga live-in partner, unfortunately, hindi pwede. Okay, so spouses lang pwede, legally married spouses, okay? And then legitimate descendants, so children who are of legal age, okay? Ascendants, so parents, grandparents, collaterals, so this includes your siblings, which is in this case, yung answer sa tanong natin. And then nearest of kin. So, si brother and sister, mauna kaysa kay tito and tita, okay? And any legally appointed guardian in the state or government. So the MD must first try to obtain consent from these people before they proceed to a medical intervention. If wala talagang available, then the MD can be the one to give their consent based on their judgment in the patient's best interest. Okay? As with the principle of beneficence. So for minors naman, mauna yung ascendants. Okay? So parents, paternal grandparents first, and maternal grandparents, then any sibling of legal age, and then the guardians. Okay? So how do I remember it is self-first, so a patient who is of legal age and has a sound mind to make decisions, and then their better half, so a legitimate spouse, look down towards the descendants, look down, and then look up towards the ascendants, and then look left and right. So yun yung mga kapatid, no? And then nearest kin, so mga tito, tita, and other family members. Okay? So next, the Board of Medicine wants to issue an administrative liability to a physician. The level of evidence needed for conviction is only substantial evidence. Okay? So remember, these are the three liabilities of a physician. So ito yung pwedeng kasuhan or ireklamo sa physician. So the Board of Medicine only does administrative liabilities. So they cannot do criminal and civil liabilities kasi kailangan korte talaga to. Okay? So the Board of Medicine is only allowed to warn, reprimand, suspend, and worse is revoke one's license to practice. And the level of evidence needed is substantial evidence only. So the basis of the Board of Medicine will be your Medical Act of 1959 and the PMA Code of Ethics. Okay, so again, hindi kaya ng Board of Medicine yung civil and criminal liabilities. Okay? Sige, next question tayo. Who among these physicians is less legally practicing medicine? So correct answer here is letter B. So nag-offer medical services, tas nagpabayad. Okay? So why? So here are the acts constituting the practice of medicine. So in exchange for your medical services, so it ranges from physical examination, diagnosis, treatment, operation. In exchange for that, you are paid for with fees or salaries. Okay? And then note din, aside from medical services, advertising your practice as a physician is already practice of medicine. And using the title of MD. So again, medical services, advertising your practice, and the title of MD. Those are acts constituting the practice of medicine. What are not considered practice of medicine is, like your choice letter D, a medical student, kasi part ng training nila as student is basta under direct supervision and control ng isang licensed physician. And under the Good Samaritan law, any person who renders medical services in an emergency is also not practicing medicine. So hindi siya pwedeng kasuhan ng illegal practice. Any person who performs household remedies, so mga over-the-counter meds, or sa bahay-bahay lang, hindi naman yan illegal practice of medicine. And those paramedical professionals or other healthcare professionals who engage exclusively in their practices, okay? So what's illegal practice of medicine? So MDs who do not qualify to practice medicine. So like choice A, he's advertising, diba? Those are one of the three acts. However, he has no valid certificate of registration kasi hindi pa siya nanumpa. Okay? And any physician convicted of a crime of moral turpitude is matatanggalan ng lisensya. Okay? So, like your choice letter C. Sige, next question tayo. So, sinabi na to earlier, what age can you legally practice medicine? Based on the three prerequisites, at least age 21. Okay? At least age 21. So, nasabi ko na to kanina. So, other trivia or facts lang din. So, the complete PLE, ito yung 12 subjects na kinukuha natin ngayon. However, pwede rin naman na you do a preliminary exam and your final exam. So, yung preliminary exam, what's the minimum age when you can take it? It is 19 years old after you completed 2 years of medicine. And the 4 subjects included in the prelims is all subjects before LegMed exam. So that's your biochem, anat, micropara, and physio. Okay? Baka lang din lumabas sa boards. So, in a criminal case, you found the bloodied and damaged clothing of the victim. This is not what type of evidence. So it's not a tracing evidence. Okay? So isa-isayin natin. So the clothing of the victim is, you can perceive it by sense, sight, touch, no? Therefore, it is an autoptic or real evidence kasi it's perceived by our senses. Okay? So in terms of the types of physical evidence, it is also a corpus delicti. So it establishes that a crime was committed. So nakita mo yung bloodied na clothing ng patients, yung damaged clothing. So pwedeng physical injuries, pwede siyang kasuhan, or kung namatay yung patient, homicide or murder. So it establishes na may krimen na nangyari. Okay? So associative and tracing evidences are indifferent. So associative, it associates or links a suspect to the crime. So for example, pwede rin yun sa case na to kasi bakit? So, for example, you found fingerprints of the suspect on the clothes or uh, you saw bullet remnants, kunwari, in the, so pwedeng yun yung associative evidence. However, it can't be tracing evidence kasi tracing evidence assists in locating. So kung saan napunta yung suspect. So hindi naman na ibig sabihin na you found the bloodied clothes of the victim, you can trace where the suspect is. Okay? Next, which is not privileged communication. That's your between the employee and coworker. So privileged communication is confidential, basically. Parang ganun yung gist niya. So a witness cannot be examined about information that was communicated to them in a professional or confidential relationship unless the other party consents to it. So it covers both your oral testimonies, mga salita, and other written documents. So examples are during marriage, between husband and wife, lawyer and all their staff, and paralegal. So an MD and our patients. So dito tayo important. And then confessions and public officials during their term as officials. Okay. However, privileged communication can only be invoked in a civil case. Okay. For example, if it's already a criminal case or if there's the interest of public health, justice, and public safety, privileged communication cannot be invoked and the physician must testify accordingly. Okay? Sige. Next, which of the following is an implication of the MD-patient relationship? It's only that we as physicians will render medical services to our patients. Okay? So, the law does not imply that we will cure them or that it will benefit them or that we will not commit any errors or there will not be any harm or side effects. It only says na mag-render tayo ng medical services. So what's the minimum duties and obligations of physicians? So as MDs, we should only possess the knowledge and skills expected of an average MD. So hindi naman kailangan na top 0.1% yung expectation. Yung average lang, yung pumasa sa PLE. Okay? So we use this knowledge and skill with ordinary care and diligence. We must exercise our best judgment, no? So for the patient and in good faith. So best judgment and in good faith. Parang principle ng beneficence. Okay? So terms not included are, it does not imply that our medical services will be successful. Kasi again, we're only working on what we know from other patients and populations. Okay? So iba-iba naman yung response per pasyente. That the treatment will be of benefit. So again, now successful siya, will produce certain results. Again, para extension lang din siya, will not harm. So again, di ba, there are acceptable side effects that from any intervention. So on drugs, there will be side effects that can harm the patient. Based on the principle of double effect, this is acceptable lang naman. Okay? And will not commit errors in the unhonest way. So as long as you were not negligent and you tried to watch out for what you did, hindi ka naman makakasuhan. Okay? Next, in a homicide trial, the physician recounted how they gave first aid and CPR. He is acting as an ordinary witness only. So an ordinary witness only states facts based on their own 5 perceptions or 5 senses. So sight, hearing, touch, smell, and taste. Okay? For expert witness, so they give their inferences, conclusions, or opinions. So kunwari, in this case, so ordinary witness, they explain na siya how they did CPR and why they did it. So if they will act as an expert witness when the judge kunwari asks, so doctor, do you think the ventricular fibrillation was the cause of the cardiac arrest? So as an expert witness, you can say na because on the AED, it was detected as a shock rhythm, ventricular fibrillation is a possibility. Okay, parang ganun. Sige, so next question tayo. So doctor erase lang. Okay, so doctor convicted of medical negligence. So to deter other physicians from making the same mistakes, this is the type of damages that can be awarded. That's your exemplary damages. Okay, so yung actual or compensatory. So it's compensation for losses that as they have duly proven. So kunwari, yung hospital bill ng pasyente, yung funeral bill para sa living, other medical expenses, yun yung mga actual or compensatory. So moral damages, usually it's for physical, mental, or emotional anguish. So napahiya yung pasyente, or nag-suffer ng depression. So parang ganun yung moral damages. So exemplary or corrective, this is over and above the actual damages kasi it's punishment or deterrence for others. So para hindi na gawin ng iba, ito kasi yung ibabayaran mo. So malaking halaga. Okay? So it sets an example, exemplary. So nominal are just trifling damages. So there was a wrong done by the defendant, but it's not substantial to the plaintiff. Okay? Pero the law acknowledges na may mali, kaya bibigyan pa rin ng damages. Alright? Liquidated, pag may kontrata. Pag na-breach, dun ka magbabayad. And then temperate or moderate is between nominal but less than actual damages. Okay? So it's like in between. Kaya siya temperate. Alright? Next, 45 female hiker lost for the past 3 years. Usapang inheritance. So, kailan madedeclare na pwede nang ipamana yung mga ari-arian ni 45 female hiker? That's after 7 years. Okay? So, again, I think nasabi naman to sa inyo na sa PLE, especially sa legal medicine, it can be based on the old laws or the new laws already. So let's just discuss everything, no? Para covered tayo on all bases. So after plain disappearance or absence, kung nawala lang bigla sa lupa and hindi na mahanap, 7 years before one is presumed dead. Okay? If there's high likelihood or mortality, so there's a dangerous cause. So for example, on board a vessel or cruise ship or airplane, in the military, tapos namatay during war, or ito, si patient, mountain climber or hiker. So they're presumed dead with after 4 years. However, pag usapang pamana or inheritance, it is still after 10 years. As in the new laws, it's subsequently shortened. So for a patient, bakit 7 years yung sagot? Pag usapang inheritance, di ba dapat 10 years? Remember, in the case, it already said na for the past 3 years already, nawala na siya. So, para maging 10 years, ilan na lang yung kailangan dito? That's your 7 years. Okay? So again, already see the case, no? Kasi baka iba, may specific information that would alter the answer. Okay? See, next. So, it is a woman who is conscious of sexual life but has not experienced sexual intercourse. That is a physical virgin. So, yung moral virgin, so they are not aware of the nature of sexual life. So parang baby pa, hindi pa niya alam. Okay? And then a physical virgin, they know, they're conscious about sex and the like. They have reached sexual maturity, but they have not had sexual intercourse. And they may be subclassified as true or false, depending on the hymen. So both naman are intact yung hymen, but with false, no, medyo wide and elastic. Kaya, diba, medyo hindi reliable naman yung hymen as basis for virginity. And then virgin intacta is like a similar concept to physical virgin. And then demi-virgin is a woman who allows all forms of sexual activity except vaginal sexual intercourse. Okay? Sige, next question tayo. So first molars na permanent teeth lumabas na sa child. So what is the approximate age? That's your 6 years. Okay? So remember that the first molar is the first permanent teeth to erupt, and they erupt at 6 years. Okay? And then the rest, generalization, is the teeth erupt from medial to lateral at 1 year intervals. Yung exception dyan is the first molar kasi siya yung unang-una kasi hindi naman siya most medial. And then the canines, so parang mas later in life siya, so at 11 years pa siya. And then the third molar, so although it's the pinakagilid, it appears later in life pa, up to 18 years or even some sa adults na. Okay? So just remember these three na exceptions, and then the rest, okay, guide mo na lang medial to lateral. Okay? That's +1 na. Okay? So briefly lang din, so the deciduous or temporary teeth, yung important lang emphasize ko is the first teeth to erupt are your lower central incisors, sa mandibular central incisors. And again, 6 years yung permanent teeth, sa kanila naman 6 months yung first deciduous teeth natin. Okay? And then ito rin, just review it on your own. So parang based on years, tapos number of teeth, no? So parang 9, 11, 13, plus 2, plus 2. Ito naman, plus 8, plus 8. So 12, 20, and 28. Okay? So plus 2, plus 2, plus 2. Ito naman, plus 8. Okay. Next, which is not a hallucinogen, that's your methanol. So hallucinogens are psychomimetic drugs that put you in a psychedelic or dream-like dissociative state, which can result in reckless behavior. So they may be natural, like your marijuana, mushrooms, and catnip, or synthetic, like your LSD, MDMA, and PCP, and ketamine. So MDMA is actually your ecstasy, all right? So deliriants naman, this includes methanol, ethanol, nitrous oxide, and toluene. Okay, so next question. At which blood alcohol level is someone starting to become unfit to drive motor cars? That's your 100 mg%. So, at 100, unfit to drive na. Pag staggering ka na, mas mataas na yun. So, you don't need to be staggering to be unfit to drive. Okay? Take note na rin in personal aspects, ha? Okay. So, how I like to memorize that is my personal Red Horse method. So, assume na may kalendarya in the Philippines ngayon na isang bote ng Red Horse, 50 pesos lang. So, 50 pesos, equivalent yan sa parang 50 mg%. So, one bottle of Red Horse, 50 pesos, 50 mg%. Tapos magpapainom ka ng friend mo na hindi magaling uminom. Okay? So, at less than one bottle of Red Horse or less than 50 mg%, feel good pa lang sila. So, there's a pleasant clearing of the head. Parang sabi nila, uy, okay ito ah. Fun uminom. Ganon. Tapos naubos na nila isang bote ng beer. So, 50 mg% na yun. So, nagsistart na sila maging tipsy. Pero goods pa rin. So, less inhibitions na lang. Sila more self-confidence. So, yung friend mo, sabi na, uy, pare, parang may cute si ate girl sa kabila. Or si, for friend mo naman na babae, so parang sabi, uy, parang I wanna dance, ganyan. Anyway, so, yun pa, diba? So, 2 bottles na ng Red Horse. So, 2 times 50, that's 100 already. So, ito na, tipsy na, pero nakakahiya na yung tipsy niya. So, nakakahiya na yung tipsy na, so wala na siyang critical judgment. No? So, parang si friend mo sabi niya, uy, pare, kunin ko yung number niya sa kabila. Or si ate girl mo na friend dyan, sumasayaw-sayaw na, alright? So, nakakahiya na, but tipsy. And take note na pag tipsy ka pa lang, doon na unfit to drive ka na actually. So, hindi kailangang lasing ka para unfit to drive ka. So, remember that personal note. Sige, so uminom ka pa. Naka 3 to 5 bottles ka na. So, 3 times 50, 150 to 300 na yan. So, lasing ka na. So, there is motor inhibition already. So, disoriented, slurred na yung speech mo, dizzy ka na, pag ganan-ganan ka na pa naglalakad sa bar. Okay? Pero sige, sabi mo, feeling malakas kasi si friend mo, sige, inom pa, naka-6 na, 6 na bote na. That's 300 mg%. So, at that point, basag na siya. So, patulog-tulog na siya, ayaw na, lumakad, ganon. So, nakatulog na lang, nakandusay na, alright? Pero sige, tinay niya pa rin uminom kasi malakas daw siya. So, more than 6 Red Horse, so anything beyond 300. So, basag as hell na sila. So, impaired sensorium na, hindi na, kahit tinatapik mo na, hindi pa rin nag-respond. And nakakaya na talaga kasi, dalhin mo na sa hospital basically. Kasi pwedeng may unstable vitals na altered sensorium and fecal and urinary incontinence. Okay, so I hope that helps you kasi yun yung gamit ko sa boards and may nasagot naman ako sa exam noon. Okay, so last 5 questions. Which is a characteristic of a gunshot wound? So correct answer is Ender's wound does not involve the clothing. So with a suicidal gunshot wound, you want the area that will guarantee the most success and the less pain in the shortest amount of time. So usually sa ulo, sa heart, sa pulso, di ba? If you're doing suicidal stabbing, and usually it's in a closed or locked out room, there's no disturbance, and there is a suicide note or may personal history siya ng unresolved personal problems. So the death weapon is usually located near the victim kasi after barilin, it will drop. Isa lang usually yung shot, and the direction of fire is compatible with the trajectory. So usually yung recoil kasi pataas. So if they shoot the gun, pataas usually yung trajectory. Whereas kung homicidal, usually pababa. Okay? So homicidal usually there's an altercation, there are defense wounds, multiple yung shot from a distance siya. Hindi siya contact fire. Unlike yung suicidal gunshot wounds. Okay? Next question. Sexual intercourse with an animal, that's called your bestiality. So necrophilia, sexual intercourse with a corpse, gerontophilia with an elderly, and pedophilia with a child. Okay, so these are some of the sexual abnormalities based on your choice of sexual partner. Next, which of the following are aggravating, which of the following is not pala an aggravating circumstance that will elevate it to murder? That's your letter B. Kasi this is not an element of treachery. So here are the aggravating circumstances that will elevate a crime to murder. First is, of course, treachery. So you betrayed them, hindi mo binigyan ng chance to defend. So usually it's for posterior na lesion. So nakatalikod yung tao, binaril mo, pinatay mo. Okay? Others are use of superior force or means to weaken or impunity. So impunity, that just means there's a means to escape. So grupo ng malalaking tao against a child, mauling, so binugbog mo muna bago patayin, and sa gabi kasi there's a greater chance to escape at night. During a disaster, kasi stress na yung tao sa disaster, pinatay mo pa. In the presence of a president or the Malacanang, kasi it's a uh, holy grounds or parang sacred grounds, ganun. And adding insult to injury, so parang pinatay mo na, you gouged out the eye, pinutulan mo ng kamay, you mutilated the genitals, parang sinunog mo pa, parang gano'n. That's adding insult to injury. Eh, pag may perang involved and if there's evident premeditation. Okay? So last two questions. 17 female deceived to have sexual intercourse by her stepfather. So deceived, so parang you can imply there's consent, but it was done with cheating or parang deceit. Okay? So kasi yung rape is forceful, di ba? Forceful or with intimidation. Not with deceit. So yung mga seduction, that's done with deceit. Okay? So hindi na rape. So the correct answer here is simple seduction. So let's discuss why. So seduction is the act of sexual intercourse with a woman who is single or widow and is age over 12 years but less than 18 years. So ngayon binago na ata, no? Just note na parang 16 years to 18 na. Kasi sex below 16 years is already considered statutory rape. Pero baka hindi pa updated yung Board of Medicine, kaya note lang na 12 yung dating definition. And there's seduction through deceit. So there's a fraudulent promise or cheating. So niloko mo basically, parang ganun. And it's considered qualified seduction if the woman was a virgin. And the seduction is usually done through abuse of one's authority or confidence or trust. So usually it's persons close to the victim, such as persons in public authority or mga domestic na guardians nila. Okay? And it's considered incestuous if it's done by a blood relative. There's a problem. Hindi naman sinabi na virgin yung patient. There's deceit, so it's not rape. So hindi virgin, and si stepfather, hindi naman siya blood relative. So the answer is simple seduction. Okay. Sige, let's end this with the last question. So, nag-charge si Dr. A ng 200,000 for a cosmetic rhinoplasty. Baliktad pala si Dr. B yung nag-charge kasi siya yung gumawa. So, who will the Board of Medicine side with? So the correct answer is letter D. So the procedure is unnecessary and not covered by professional courtesy. So again, when you do the oath and part ng PMA Code of Ethics, diba, is waiving of professional fees to colleagues. However, in section 7.2, it specifically states na we only waive PFs when we provide essential and evidence-based medical care to our colleagues. So again, essential, keyword on essential. So, since the rhinoplasty is purely cosmetic, pwede kang i-charge ng yung colleagues mo in this case. Kasi kung gano'n, di left and right, may nagpapa-rhinoplasty, may nagpapa-liposuction, may nagpapa-gastric bypass atin, ano pa ba? Nagpapa-derma ng for free, diba? So, kawawa naman yung mga colleagues natin. So, okay, so you can check the PMA Code of Ethics through this link. It's a short article naman, you can browse through it. But I think it's also in your handout. Okay, so that was legal medicine and preventive medicine. Thank you for listening.
Guys, let's go to Patho. So, take a deep breath. Patho is really hard. It was the most difficult exam noong October 2022. So, bear with me. Mahirap talaga to, pero kakayanin nyo. Promise. Okay, let's start. 101. Which of the following features is consistent with necrosis? And the correct answer is C, presence of inflammation. A, B, and D all pertain to apoptosis. Okay, let's look at this very, very high yield illustration of how normal cells react to stress. So typically, when you expose a cell to stress and injurious stimuli, cellular injury and adaptation occur. So these include yung mga hypertrophy, hyperplasia, atrophy, and metaplasia. Pag hindi na niya kayang mag-adapt, bale it's reached its limit, nagkakaroon ka na ng injury. So, if it's reversible, nagkakaroon ka ng cellular swelling or fatty change. If it's irreversible, then nagkakaroon ka na ng mga necrosis and apoptosis, which are indicative of cell death. Okay, let's differentiate the two. Necrosis versus apoptosis. Necrosis is matic pathologic, while apoptosis may be physiologic. In necrosis, the cell membrane is disrupted, there's inflammation, and it typically appears eosinophilic with nuclear shrinkage, fragmentation, and dissolution, and associated myelin figures. On the other hand, apoptosis, intact yung cell membrane, absent yung inflammation, and it appears on the microscope with decreased cell size and chromatin condensation. So, pag messy, usually necrosis yan. Pag malinis, usually apoptosis yan. Okay? Okay, 102. A 32-year-old male presents with joint hypermobility and scoliosis. There is history of the same disease across generations, and boom! A diagnosis of Ehlers-Danlos syndrome is considered. Genetic testing reveals a COL1A1 mutation. What is the specific type? So the correct answer is B, arthrochalasia. So this table was taken from our Pathobible Robbins, and it summarizes the EDS types and their respective gene defects. So, I recommend that you just look at this table right before the patho exam because it's almost impossible to memorize. So, just take a peek before the exam, the night before the exam, para ma-store nyo siya sa short-term memory. Okay, let's go to 103. A 33-year-old female presents with an erythematous rash on the malar area, but she is otherwise well. Serologic studies show positive ANA, but anti-dsDNA is negative. What is the diagnosis? And the correct answer is chronic discoid lupus erythematosus. Why? Because ang symptom lang niya is cutaneous. Cutaneous lang, therefore, cutaneous, chronic discoid LE. Let's look at the types of lupus. Chronic discoid LE, cutaneous, skin lang. Systemic manifestations are rare, and ANA lang ang positive. Whereas subacute cutaneous LE, skin manifestations, tas nagkakaroon na rin ng systemic symptoms. Whereas drug-induced LE, may characteristic anti-histone antibodies. Okay? Alright, let's look at the antibodies in SLE. ANA is the best screening test. Anti-SM is specific for SLE. Anti-dsDNA correlates with disease activity. Antihistone is associated with drug-induced lupus. Anti-Ro and anti-La are associated with neonatal lupus and congenital heart block. While antiphospholipid antibodies, also called the lupus anticoagulant, may produce false positive results in non-treponemal serological tests, yung for syphilis. So how do you remember? Ang dami-dami. Well, one of them, the most important is anti-dsDNA. DS, anti-dsDNA. D and S, disease specific. Okay, lagi nilang tinatanong yan, super high yield. Okay, 104. A 38-year-old female presents with heartburn and difficulty in moving her fingers. Physical examination shows tightened skin over both sets of fingers. There is no history of any bone marrow transplantation. What autoantibodies should be included in the serologic panel to diagnose this disease? So this is a two-step question. Una, ano yung diagnosis mo? Pangalawa, ano yung laboratory test na gagawin mo? Let's look at the case. Sabi dito, merong heartburn and difficulty moving fingers. Difficulty moving fingers, parang it sounds like sclerodactyly eh. Heartburn, pwedeng esophageal dysmotility. Tapos, isipin mo, autoimmune. So, this sounds like the CREST syndrome. And in the CREST syndrome, you would use the anti-DNA topoisomerase 1 as part of your serologic panel. So, let's discuss scleroderma, particularly the CREST syndrome. It presents with calcinosis, Raynaud phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia, and it's associated with the following autoantibodies: anti-scleroderma 70, and which is also called the anti-DNA topoisomerase 1, and it's also associated with the anti-centromere antibody. So let's look at the autoantibodies in systemic autoimmune diseases. So SLE, you have the ANA, dsDNA, mu1-RNP, and Smith. Systemic sclerosis, DNA topoisomerase 1 and centromeric proteins. Sjogren's syndrome, anti-Rho, anti-La. Autoimmune myositis, JO1 and MI2 nuclear antigen. Rheumatoid arthritis, you have the CCP and RF. So, gosh, ang dami nito. How can I remember? Well, at least for CREST, you have C and T, anti-centromere, letter C, and anti-DNA topoisomerase, CREST. Okay? So 105, a 24-year-old male blood donor tested positive for HIV 1 or 2 antigen or antibody immunoassay with indeterminate results on HIV-1, HIV-2 antibody differentiation assay. According to the CDC, what is the next test to request to confirm the diagnosis? The correct answer is nucleic acid amplification. Okay, so let's look at this algorithm from the CDC on how to diagnose HIV. So first, you would start with an HIV 1 or 2 antigen antibody immunoassay. Basically detects if merong HIV 1 or 2. And then you want to differentiate, is this HIV 1 or HIV 2? But if it's indeterminate, you go to the third level in which you use a nucleic acid test. Okay? Alright. Let's go to 106. Which of the following tumor markers is expected to be elevated in breast cancer? Let's look at the choices. AFP is for liver and germ cell tumors. CEA is for colorectal cancer. CA19-9 is for pancreatic, gallbladder, bile duct, and gastric cancers. So that leaves us with CA15-3, which is for breast cancer. Although, admittedly, it's not so popular. Usually, ang alam natin dyan yung estrogen receptor, progesterone receptor, and HER2/neu. Pero apparently, pwede rin ang CA15-3. Okay? So let's go to 107. A 45-year-old male presents with an ulcerating lesion on the forehead. Biopsy shows granulomas with central coagulation necrosis and a plasma cell-rich infiltrate. Which of the following laboratory tests should be requested to confirm the diagnosis? So may TB-PCR, Lepromin, FDA, RPR. So the first one is for TB, the second one is for leprosy, and the CND are for syphilis. So medyo tricky to, no? So you have to decide, given the morphology of the biopsy, is this TB, is this leprosy, or is this syphilis? And in fact, it is actually syphilis. And what is the confirmatory test for syphilis? It's a treponemal test, FTA-ABS. Kasi RPR, it's non-confirmatory, it's non-treponemal. So, paano natin nasabi na doc syphilis to? It's based on the morphology. So, each of those 3 diseases has a different morphology histologically. Let's look at them. For tuberculosis, you have a caseating granuloma with a focus of activated macrophages, rimmed by fibroblasts, lymphocytes, histiocytes, and Langhans giant cells. Whereas in leprosy, there's a non-caseating granuloma. And in syphilis, There's central necrosis bordered by histiocytes, and the buzzword here is plasma cell infiltrate. So, na-mention sa case no na may specific plasma cell infiltrate, therefore we can narrow down our diagnosis to syphilis. Okay, how do we diagnose syphilis? There are non-treponemal and treponemal tests. Non-treponemal are used for screening. Kasama dyan yung RPR and VDRL. Whereas treponemal tests are confirmatory. Kasama dyan ang FTA-ABS and MHATP. So sa question natin, it was about the confirmatory test for the disease entity, no? So ang sagot natin is FTA-ABS. So this is a difficult question. Ilaban natin to, guys. 108. Which of the following bioterrorism agents fall under category B? So, minsan lumalabas din to. It's a recall question. Let's look at the choices. Nipah virus and hantavirus, category C. Bacillus anthracis is category A. Ang category B lang dyan is C. Coxiella burnetii. Okay, let's look at the bioterrorism agents. Yung mga category A, they're very easily spread. So, kasama dyan yung anthrax, Clostridium botulinum, Yersinia pestis, smallpox, tularemia, and viral hemorrhagic fevers. Whereas in B, it's moderately easy to spread. Kasama dyan brucella, Clostridium perfringens, food safety threats like E. coli and cholera, Burkholderia, Chlamydia psittaci, Coxiella, Rickettsia, and as I mentioned earlier, cholera. C, nandiyan ang Nipah virus and hantavirus. So, how can you remember? Okay, I made a simple mnemonic. Bioterrorism category A, A, B, C, D, S. Anthrax, Botox, Yersinia, dengue, viral hemorrhagic fevers, and tularemia, dularemia, and S, smallpox. So, A, B, C, Ds. 109. A 35-year-old male proprietor of a piggery presents with seizures. Imaging shows multiple cystic lesions in his brain. Which of the following events is the most consistent with the patient's disease? So, merong kang parang parasitic infection, no? This is a crossover with microbio. And ang patient demographic mo is an owner of a piggery. Tapos, merong neurologic symptoms. So, ano yung consistent with the disease? It's actually the ingestion of eggs. So, what's the disease? It's actually an infection due to Taenia solium. Particularly, it's neurocysticercosis. But remember, infection with T. solium can cause two different diseases. It can be Taeniasis or cysticercosis. In Taeniasis, man is the definitive host and it's due to ingestion of larvae. It typically presents with abdominal complaints. Whereas in cysticercosis, man is the accidental intermediate host. It's due to the ingestion of eggs, and it may cause neurocysticercosis, which presents with seizures and motory or sensory deficits. So how do you remember, no? So here's a simple mnemonic: eggs in the brain. Ingestion of T. solium eggs can cause neurocysticercosis. So if you look at this CT scan of the brain, di ba parang may itlog-itlog sa brain? So, when you ingest eggs of T. solium, mapupunta yung itlog dun sa utak mo. Neurocysticercosis. Okay? Alright, let's go to 110. Which of the following mechanisms of secondary hypertension is correctly paired? And the correct answer is C. Cushing syndrome is to increased peripheral resistance. Medyo confusing to, no? Kasi parang lahat sila tama. But let's look at the types of hypertension. There's essential, which is due to genetics and environmental factors, and there's secondary causes. So it can be renal, which is due to the RAAS, which is caused by increased intravascular volume. It can be Conn syndrome, which is due to aldosterone excess, which also increases the intravascular volume. And it can be due to Cushing syndrome, which causes increased vascular sensitivity to catecholamines, therefore increased peripheral resistance. Pheochromocytoma, ganun din. Increased catecholamines, increased peripheral resistance. And in thyrotoxicosis, there's increased cardiac output. Okay, so here's a simple mnemonic. Ako nung nag-aaral ako, medyo nalilito ako sa Con versus Addison disease. Con over sa aldosterone. Con over sa aldosterone. And Addison alang aldosterone. Okay? So they're opposites. Let's go to 111. What is the most clinically significant component of TOF? And the correct answer is right ventricular outflow tract obstruction. Okay, before that, let's discuss the components of TOF, which is PROV, pulmonic stenosis, RVH, overriding aorta, and VSD. Let's discuss the pathophysiology of TOF, no? So, if there is severe right ventricular outflow tract obstruction, tumataas yung pressure sa right side ng heart kumpara sa left side ng heart. And remember, blood flows from high pressure to low pressure. So, kung mataas ang pressure sa right side ng heart, magkakaroon ng right to left shunting. But remember also, ano ba yung nasa right side ng heart? Oxygenated or deoxygenated blood? Diba it's deoxygenated kasi galing siya sa venous system? Therefore, if there's right to left shunting, deoxygenated blood will go to the left side of the body to the systemic arteries. Therefore, nababawasan yung oxygen circulation and it causes cyanosis. So, if your RVOT is really bad, then your TOF presentation will be worse. Okay? Okay, let's start. 112. A 33-year-old female with SLE presents with pallor and easy fatigability. CBC shows low hemoglobin and hematocrit. Peripheral blood smear shows spherocytes. What test should be requested to diagnose this condition? And the correct answer is the direct Coombs test. So, bakit? Let's discuss hemolytic anemias, no? So, in the case, our patient has SLE. So, which type of hemolytic anemia is associated with SLE? Is it thalassemia, PNH, hereditary spherocytosis, G6PD, or immunohemolytic anemias? The answer is immunohemolytic anemias. Yun ang associated with SLE. So let's discuss the autoimmune hemolytic anemias or IHAS. This is caused by antibodies that bind to red cells and it's typically extravascular hemolysis. There are three types. The warm antibody type, which is typically idiopathic. So ang pathophysiology nito, IgG coats the RBC, therefore tagging it for phagocytosis. So dahil na phagocytose nakakagat yung RBC membrane, nagkakaroon ka ng spherocytes. And eventually, these spherocytes will be sequestered by the spleen. The spleen will be like, oh, this is an abnormal RBC. I will take it and throw it away. Therefore, it causes extravascular hemolysis. There's also the cold agglutinin type, typically post-infectious and associated with cancer. What happens is IgM binds to the RBC in cold body areas, kaya siya cold agglutinin type. So, dahil nababind yung IgM sa RBC, nagkakaroon ka ng vascular occlusion, therefore Raynaud's phenomenon. And this is also extravascular hemolysis. Whereas in the cold hemolysis type, it's intravascular hemolysis. So, let's go back to the case, no? Sabi doon may SLE. So, alam na natin, this is probably warm antibody type, you know? And so, how would you diagnose that? You would use the direct Coombs test. Okay, direct Coombs test. Alright, let's go to 113. A 55-year-old smoker presents with chronic productive cough with copious sputum and repeated bouts of pneumonia. Spirometry findings show an FEV1-FVC ratio of 0.5, which is very, very decreased. What is the expected morphologic finding in this case? So again, this is a two-step question. You have to decide what's my diagnosis and how would this present histologically. So the correct answer is enlargement of mucus secreting glands because this is probably chronic bronchitis. So bakit? Let's discuss COPD. So there are two types of COPD, emphysema and chronic bronchitis. So emphysema usually pink puffer, chronic bronchitis, blue bloater. So what's the definition of emphysema? It's the enlargement of air spaces. Chronic bronchitis naman is a persistent productive cough for at least 3 months in at least 2 consecutive years. Both of them are caused by inflammation and tissue damage caused by cigarette smoke and particles. But they have different presentations and morphology. In emphysema, there's large alveoli. Basta emphysema, large alveoli. Whereas in chronic bronchitis, there's mucopurulent secretions grossly. And in histology, there's an enlargement of mucus-secreting glands. So in the case, di ba nasabi na meron siyang obstructive pulmonary disease, tapos very prominent yung cough, productive cough. So that's probably chronic bronchitis, no? And that would present with enlarged mucus-secreting glands on histology. Okay, let's go to 114. A 56-year-old male known case of GERD has been abusing proton pump inhibitors. EGD shows multiple polypoid lesions throughout the stomach. Which of the following is the most likely diagnosis? So the correct answer is B, fundic gland polyp. Let's discuss gastric polyps. No, there are 3 types: inflammatory, fundic, and gastric adenoma. Inflammatory polyps are associated with H. pylori, and as in the name itself, it's an inflamed polyp, and it's actually the most common one. Whereas fundic gland polyp is associated with proton pump inhibitors. So, as in the case, may proton pump inhibitor use tayo, kaya most likely fundic gland polyp yon. And gastric adenoma, it's associated with chronic gastritis, atrophy, and intestinal metaplasia. Let's go to 115. Which of the following features favors Crohn's disease? Let's look at the choices, no? In Crohn's disease, meron ba tayong diffuse lesions? No, it should be skip lesions. Do we have mucosal involvement only? Nope, it should be transmural. And do we have large caseating granulomas? Nope, it should be non-caseating. So the correct answer is deep knife-like ulcers. So here's a very beautiful comparison of the two. In Crohn's disease, you have skip lesions and transmural inflammation. In ulcerative colitis, it's continuous, pero dun lang sa colon and rectum. And you have medyo mas mababaw yung lesions niya, no? May pseudopolyps ka. Here's a very, very beautiful table. So we already discussed the macroscopic and microscopic differences. In terms of clinical differences, mas maraming clinical symptoms ang Crohn's disease. As you can see at the bottom of the table, may perianal fistula, may malabsorption, may high risk for recurrence. Pero the thing is, in ulcerative colitis, mataas naman ang chance mo for toxic megacolon. Okay, let's go to this mnemonic. Crohn's, 2 C's. Skip, and crater. Crater for deep transmural ulcers. Hey guys, kapit lang tayo. 9-year-old non-obese female presents with vaginal bleeding. Physical examination shows well-developed breasts and pubic hair and abdominal enlargement. Imaging shows an adnexal mass. What is the most likely diagnosis for the adnexal mass? Okay, and the correct answer is granulosa cell tumor. Bakit? So, titingnan natin tong table na to for ovarian tumors, no? So, there are 3 types: epithelial, germ cell, and sex cord stromal tumors. And each of them has a different age profile. Usually, yung mga epithelial older, germ cell younger, and sex cord any age. They also have different markers and different histological types, but the most important thing in this table is the presentation. For epithelial, usually abdominal pressure, bloating. Whereas in germ cell, there's also pelvic pain due to rapid growth. Ang pinaka-characteristic dyan yung sa sex cord stromal, no? Because it produces estrogen and testosterone, you have precocious puberty, AUB, and masculinization. Let's go back to the case. 9-year-old, tapos meron ng vaginal bleeding. Apakabata pa niya, tapos meron na siyang breasts, meron na rin siyang pubic hair. So, this is obviously a case of precocious puberty. The most likely type of ovarian tumor in this patient is sex cord stromal. And among the choices, ang sex cord stromal lang dyan is granulosa cell tumor. So, the granulosa cell tumor produces excess estrogen, producing precocious puberty. Okay, let's go to number 117. Which of the following conditions is protective from high-grade serous carcinoma? Let's look at the choices. Nulliparity, endometriosis, and BRCA mutations actually increase the risk. The only one that is protective is letter A, tubal ligation with fimbriectomy. Why? Let's look at this table. Ovarian serous tumors are the most common ovarian surface epithelial tumor. It has tubal-like epithelium. They actually postulate that it comes from the fallopian tubes. Therefore, tubal ligation is protective. So, this table actually came from your gyne handout. So, the following increase the risk for ovarian serous tumor, yung family history, obesity, endometriosis, smoking, increased ovulatory age. Alright, and the following decrease the risk, decreased ovulatory age, breastfeeding, OCPs, increased parity, tubal ligation, and carotenoids and T. Okay? Let's go to 118. Which of the following neurodegenerative disorders will typically not present with dementia? Okay, and the correct answer is ALS. Why? So here's a summary table of neurodegenerative diseases. You have Alzheimer's, which also presents with dementia. Parkinson, may dementia din. Huntington, dementia, and chorea. Creutzfeldt-Jakob disease, progressive dementia, and startle myoclonus, and ALS. ALS is neurodegenerative pero wala siyang dementia. Mostly motor symptoms siya because of the loss of upper and lower motor neuron. It presents with weakness and atrophy. Pero intact naman yung mga cognitive functions mo. Okay? Let's go to 119. An infiltrating glioma has both IDH and 1p19q co-deletion. Which of the following is the most likely diagnosis? I'm sorry guys, this is just a recall question of CNS tumors, and the correct answer is oligodendroglioma. Let's summarize yung mga genetic mutations. Again, just look at this right before your exam. Store it in your Pandora's box of short-term memory. Primary glioblastoma, IDH. Secondary, IDH. Oligodendroglioma, IDH, and 1p19q. Pilocytic astrocytoma, BRAF. Ependymoma, NF2. Medulloblastoma, Wnt, and sonic hedgehog. Last for patho. Okay. 120, a 65-year-old patient presents with progressive headache. Imaging shows an extra-axial dural-based mass. What is the most likely cell of origin of this tumor? Ang keyword dito, dural-based. So, matik, alam na natin, it's meningothelial cells. It's a meningioma, no? Buzzword dito talaga is yung dura. It arises from the meningothelial cells of the arachnoid and is associated with NF2 deletion, CH22Q12. And on neuroimaging, merong dural tail. Alright? Whew! Nahirapan ako doon. I'm sure nahirapan din kayo, pero kinaya nyo, diba? Let's go! Okay.